I'm Dr. David Mugford. I'm a periodontist and the founder of the Mugford Center. I want to welcome you to my educational series on dental health. Sleep apnea or sleep disruption is linked with many serious illnesses. Much higher risk for strokes, heart attacks, sudden death, depression, obesity, high blood pressure, fibromyalgia, and the list goes on and on. We put ourselves at much greater risk when we can't heal properly during sleeping. One of the most common treatments for sleep apnea is the use of a CPAP machine. A CPAP machine is forced air that is blown into the nose in order to expand the airway so that air can continually get in during sleep. What happens when we're sleeping is that the muscles all begin to relax and everything starts to collapse in around the neck, including the tongue falling to the back, which constricts the airway. The CPAP solution solves this by blowing air through the nose and opening the airway. The compliance on this machine is very poor. Only about 1 in 5 people actually will use the machine because it's uncomfortable to wear. It has straps on the head. The air flowing in dries out the nose, the noise of the machine. So although people are aware that they need help, they really don't want to use their CPAP machine. Until recently, we've had limited alternatives. One treatment for mild sleep apnea is an oral appliance. An oral appliance is like a bite guard or a retainer. It's worn and it actually props the lower jaw forward just enough to keep the airway open. Unfortunately, some of the earlier appliances only had success in mild sleep apnea. With current research and refinement, particularly with the methodology from Dr. Metz, we can now treat even the most severe sleep apnea patients without a CPAP machine and get at least as good results, if not better, without using all of the instruments and machinery in order to keep the air flowing. Compliance is much better with the oral appliance as well. Once the sleep apnea is resolved and adequate sleep is achieved, many other health problems can resolve. The patient's sense of stress is improved and their other medical conditions, especially related to the heart, can be improved. Although many people don't feel as though they have a breathing issue or sleep apnea, they can feel tired or stressed out. And sometimes it's an undiagnosed sleep problem. The best way to determine if you can be helped with the oral appliance is by doing a sleep screening. Sleep screening can be done in our office using a simple home screening device which is worn on the finger for 3 nights, or a sleep study can be performed at a sleep center and they can determine whether or not your lack of sleep is due to a breathing problem.